You know, when you put a stethoscope on someone's chest, you're doing way more than just a routine check. It's like you're leaning in to hear a secret language, a story that the body is trying to tell you. And in this explainer, we're going to learn how to translate it.
So, what are a patient's lungs actually trying to tell you? Well, that's what we're here to figure out. Think of this as a mission. We're going to decode 3 of the most important messages you'll ever hear. We're going to take all those confusing sounds and turn them into crystal clear clues that can lead you right to a diagnosis.
All right, let's kick off our investigation with clue number 1. This is a sound that's super sharp, really distinct, and it tells a very, very specific story about what's going on deep inside the lungs. Let's decode the pop.
Okay, so when you hear that crackling sound, your brain should immediately go to one word: fluid. Now, we're not talking about some gunk in the big airways. No, this sound is coming from way down deep, from the tiny little air sacs themselves, the alveoli. It's a dead giveaway that there's fluid where only air should be.
And that fluid, it points us to some very specific culprits. We're talking about things like pneumonia, where an infection causes all that fluid to build up. Or it could be congestive heart failure, which leads to pulmonary edema. And in really severe cases, you'll hear it in ARDS. So just by hearing that sound, you've instantly narrowed down what could be going on.
So here's the best way to remember this. Just picture the alveoli as these teeny tiny balloons that are all stuck together with fluid. Then, when the patient takes a breath in, air rushes in and forces them to pop open. That sound, that is the crackle you're hearing. It's a perfect description of the sound, right?
Okay, moving on to clue number 2. This one tells a totally different story. We're shifting gears now from the pop of fluid to the squeeze of a tight airway.
A wheeze? Well, that's the sound of a struggle. It's telling you that the lower airways, the bronchioles, are getting narrow. They're tight. Air is having a really tough time passing through, and that obstruction creates this really high-pitched musical sound.
This sound is like the classic sign, the hallmark of any disease that causes the airways to constrict. You're going to hear this in asthma, in COPD for sure, but it can also be a major red flag for a severe allergic reaction. We're talking anaphylaxis, or even inflammation down in those tiny airways, like with bronchiolitis.
Here's the analogy for this one. Just imagine trying to force air through a really narrow straw. See? It makes that high-pitched kind of musical whistling sound. That right there is a wheeze. It's literally the sound of air under pressure just fighting to get through a tiny, squeezed-shut space.
And now for our third and final clue, the last piece of this puzzle. This sound is different. It's lower, it's rougher, and it points to a problem in a totally different spot than the first 2 sounds we talked about. Let's get into the gurgle. So, unlike crackles, which are way down in the tiny alveoli, or wheezes in the smaller airways, Rhonchi, well, they're all about the big highways of the lungs, the bronchi. This sound is telling you one thing: there's thick mucus, secretions, just rattling around in those big tubes.
It makes sense then, right? You're going to hear Rhonchi in any condition that's known for producing a lot of, junk. We're talking bronchitis, some types of pneumonia, and those stages of COPD where mucus production just goes into overdrive. It's the pure sound of congestion.
What does it sound like? Think of a low-pitched snore or a gurgle. But here's the real pro tip, the diagnostic giveaway. Because all that gunk is in the large airways, if you have the patient give a good, strong cough, it can actually clear it out. The sound might change or even go away completely. That's a classic sign that you're hearing Rhonchi.
All right, we've got all our clues. We have the pop, the squeeze, and the gurgle. So now it's time for the big reveal. Let's put this all together into one simple, super powerful cheat sheet that you can take with you.
Let's lay it all out, side by side. First up, crackles. That's the pop. It means fluid, just like popping open those little wet alveoli. Next, wheezes. That's the high-pitched whistle. It means the airways are narrowed, like air being squeezed through a tiny tube. And finally, Rhonchi. That's the low gurgle. It means mucus in the large airways, the kind that often clears up with a good cough. When you see it like this, the differences are just crystal clear, aren't they? Okay, time for a quick rapid-fire review to really hammer this home. Ready? You hear crackles, you think fluid. Got it?
Next one. You hear wheezes, you think narrowed airways. Simple as that.
And last one. You hear Rhonchi, your brain goes straight to mucus.
Perfect.
So look, if there is one thing you take away from all of this, let it be this one super concise line.
Seriously, if you can just remember this one sentence, you have pretty much mastered the secret language of the lungs. Ready? Crackles equals fluid. Wheezes equal narrowed airways. And Rhonchi equals mucus in the large airways. And just like that, you're equipped. You have the code. From now on, you're not just hearing random noises through a stethoscope. You're hearing specific, meaningful clues. You're hearing a story. So the only real question left is, now that you speak the language, what are you going to hear first?